So good day everyone, I'm Briggs Pelayo from BSN1M78. So today I'm going to do a return demonstration about cold and hot compress. To demonstrate the proper technique in applying hot and cold compresses, ensuring patient safety and comfort while achieving therapeutic effects such as pain relief, reduction of inflammation or swelling, or improvement of blood circulation. For step 1 to 6, same procedure in patient for hot and cold compress. Step 1. Verify the doctor's order for the cold compress and hot compress, including the type of moist, cold and hot application, location and duration, and desired temperature. Step 2. Review client's chart for medical history and contraindications such as poor circulation, impaired sensation, or vascular disease that may contraindicate cold and hot compress. Step 3. Gather all the materials needed near the bedside. So we have here the gloves, the washcloth, the waterproof pad, the compress bag with the ice, and then the basin with the warm water. Then next, perform hand hygiene and apply clean gloves. Then next, grade and identify the client using 3 identifiers. So, good day ma'am. I'm Briggs Pelayo, your nurse for today. May I verify your full name?
Naturally Memorial.
Your birthday?
September 13, 2006.
Can I check your wristband po? Then next, provide privacy at all times. Since we are in the private room, I already closed the door. However, in some instances in work, we will close the curtains. So let's move on to the cold compress procedure. So first, assess the client and family's awareness, understanding of the procedure, and related safety factors. So ma'am, have you or anyone in your family ever received a cold compress before?
Yes, it was open.
Okay. Next, explain procedure to the client clearly and completely with client's approval. So now, I will explain the procedure to you. The doctor ordered a cold compress to help reduce the swelling and relieve the pain in your knee. Cold compresses are generally used for recent acute injuries with swelling, inflammation or pain, and for reducing fever. They help by numbing the area and slowing down blood flow to the injured area. We'll leave it for about 15 to 20 minutes. Would that be okay with you? Okay. Next, assess vital signs and mobility. Since I already assessed the patient's vital signs and mobility earlier, everything is within normal limits, and she is safe for the procedure. Then next, identify the expected outcomes. So ma'am, I will clarify our goal is to reduce the swelling and make your knee feel more comfortable and less pain. Then next, describe sensation patient would feel and precautions to prevent friction and or numbness. So ma'am, I will describe the sensations that you may feel. It is a bit cold, some tingling or slight numbness, which is normal. But if you feel intense cold, pain or burning, please tell me right away so I can stop the procedure. Then next, position patient in bed, keep affected body part in proper alignment, exposed body part to be covered, drape patient as needed. So now ma'am, I'll help you position your legs slightly elevated and keep the rest of you covered for warmth and privacy. Is it okay for you? Okay, cool. Then next, assess client's skin around the area to be treated and the client's temperature and pain sensitivity. Then next, inspect for any wounds. So ma'am, there are no wounds or open skin in the area, so we're clear to proceed. Then next, place a waterproof pad under the knee. So ma'am, I'm placing a waterproof pad under your leg to protect the bed linens and prevent moisture. Then before I apply the cold compress to the affected area, I will check the temperature of cold compress, then we will apply it. So now, ma'am, I am applying the cold compress now. Let me know if it feels too cold or uncomfortable to reduce inflammation and pain. Next, monitor comfort and observe skin during application. So, ma'am, how does your knee feel now?
It feels cold, but it's
That's good. I'll check your skin every 5 minutes and observe your reaction closely. Please let me know if anything feels wrong and to avoid cold injuries like frostbite, redness, or skin irritation. So I'll be right back, ma'am, after 5 minutes.
Go.
It's been 5 minutes, ma'am. So now I'll recheck the temperature of the compress bag. If needed, remove, remoisten, and reapply to maintain the cold temperature as needed. Since the cold compress bag with ice is still same temperature, we will not remoisten it. If any untoward incident or problem occur, stop the procedure immediately. So ma'am, I'll be right back again after 20 minutes. So it's been 20 minutes now, ma'am. I'm now removing the compress and drying your skin to prevent prolonged exposure which can damage your tissue. Then next, inspect the skin post-treatment. Your skin looks normal, ma'am. No redness or irritation. Do you feel any improvement? Then next, clean and store equipment. Then next, provide privacy and reposition the patient. I will now cover your knees and I will be repositioning you in comfort position. Then next, remove gloves, dispose of properly, and perform hand hygiene. Then next, identify any unexpected outcomes. So ma'am, there were no unusual findings or adverse effects during or after the procedure. So last and the final procedure, document and report. So ma'am, if you need anything, just call me on the call bell. So now, I'll go to demonstrate hand compress procedure. So first, perform hand hygiene. The next, explain the procedure and gain approval. So Ms. Morales, I will explain the procedure to promote understanding and your cooperation for the entire procedure. Your doctor prescribed a warm, moist compress to your lower back. Let me explain why. Hot compresses help by relaxing muscles and reducing stiffness and relieving chronic pain or discomfort. However, there are times we do not use heat therapy, such as when there is an open wound, impaired sensation, or has poor blood flow in the area. Is it alright for me to begin? The next, describe expected sensation and safety precautions. So ma'am, this is the expected sensations that you will feel and to be aware and safe during the entire treatment. You might feel warm, mild tingling, or relaxation in the area. But if you feel burning, stinging, or numbness, please inform me right away. The compress will stay on for about 15-20 minutes. I'll be checking with you every few minutes. Then next, position the client in Sim's position and ask for her permission to expose her properly. I will only expose the area where the hot compress will be applied. So ma'am, I will help you in a comfortable position for the procedure. Is it alright if I adjust your clothing and expose only the area where the hot compress will be applied? I will make sure to keep the rest of your body covered for privacy. Then next, assess the client's skin and temperature sensitivity for any sign of redness, irritation, or loss of sensation, then inspect the wounds. However, there is no open wounds. Then next, place a waterproof pad under the treatment area.
Magsasabihin ka.
So now, ma'am, I'm placing a towel under your back to keep the bed linens dry. Then next, apply the washcloth to the warm water of basin and wrung out the excess to avoid dripping water, then apply to the patient. I am applying the hot compress now, ma'am. Let me know if it feels too hot or uncomfortable to reduce inflammation and pain. Then next, monitor comfort and observe skin during application. So ma'am, how does your back feel now?
Di ko nasasabi.
Narinig.
Go.
Then next, monitor comfort and observe skin during application. So ma'am, how does your back feel now? Okay, that's good. I'll check your skin every 5 minutes and observe your reaction closely. Please let me know if anything feels wrong and to avoid hot injuries like first-degree burn or redness or skin irritation. So I'll be right back, ma'am, after 5 minutes. So it's been 5 minutes now, ma'am. I will check the temperature of the towel. If needed, remove, remoisten, and reapply to maintain the warm temperature. Since the hot compress is still a warm temperature, we will not remoisten it. If any untoward incident or problem occur, then stop application immediately. So ma'am, I'll be right back again after 20 minutes. So ma'am, it's been 20 minutes. I'll now remove the compress to prevent overheating and gently dry your skin. Then next, inspect treated area post-procedure. So now ma'am, I'm checking your skin again. No redness, no irritation. Did the compress relieve your discomfort?
Yes.
Okay. The next, clean and store equipment. After that, remove gloves. Privacy. Then next, provide privacy and reposition. So I will now cover your back, ma'am, and I will be repositioning you in comfort position. Then next, remove gloves, dispose of properly, and perform hand hygiene. Then next, identify unexpected outcomes. So ma'am, there were no signs of burns, skin reactions, or adverse effects. Next, reassess vital signs. So now, I'll recheck your vital signs to compare with earlier readings po, ma'am. So your earlier readings, your pain earlier is 7 out of 10. Can I ask you what level is the pain today? Okay. Then next, document and report. So if you need anything, just call me on the call bell, ma'am. Thank you.